Hello everybody and welcome to another session of Ask Us Anything. Today we are going to be talking about our own brand of aligners, OrthoAlign, and today is going to be a very simple, straightforward topic. It's just going to be how do you submit cases to OrthoAlign as a dentist. So again, with our Ask Us Anything, if you do have any questions, please feel free to ask your questions, drop us a message. Drop a comment in this video, or you can send us a message via Facebook Messenger, and we will be more than happy to answer any questions that you may have at the end of this live session. Okay, so as we continue, so the first thing that we would like to talk about is the main key things that you are going to need in order to submit for an OrthoAlign. Okay, so the number one thing that you're going to need is the patient's photos. The second thing is going to be the X-ray data. The third thing is going to be the RX form, or we also call it like a lab form. And then the fourth thing is we're going to need an intra-oral scan or an impression of the patient's upper and lower arch. Okay, so these are the bare minimum. These are the four things that you are going to need in order to submit a case for OrthoAlign. So patient's photos, we definitely want nice high quality pictures in order for our orthodontist to be able to study and see and give an analysis of what our orthodontist can potentially plan for the cases. And then of course the X-ray data that we see here on the bottom left, we want the best quality OPG scans that you can get. We will try not to get the OPG scans that are not clear. Okay, and then the next thing is the RX form. The RX form, that's going to be important. That is actually where you are going to fill in all of the information of telling what is the situation in the patient currently, what is the patient's chief complaint, and what is the patient or you as the dentist or the orthodontist looking to achieve the final result for the patient. And as you know, with OrthoAlign is communicate friendly. So if you are already using a tree-shaped Trios intraoral scanner, you can be confident enough to send cases to us via the communicate. We can accept your scans directly, so we don't have to deal with the traditional impressions. However, if you don't have a tree-shaped Trios scanner, maybe a third-party scanner, we can also more than happy accept the STL files or OBJ files that your intraoral scanner may export. But we are not only limited to intraoral scanners. Again, impressions, the traditional way, we can also accept all kinds of impressions. We definitely prefer the types that is the silicone type and try to avoid the alginate type, because we are not going to be able to re-pour the model or re-pour the stone if anything were to happen with the alginate impression or the stone that was poured by you. Okay, so the next thing that we're going to talk about is the case workflow. Okay, so what is the workflow of working with our OrthoAlign system? So the first thing you would do as a clinician or as a dentist or an orthodontist is you would do your clinical assessment. Okay, so patient selection criteria. Okay, is it going to be a simple case, a medium, intermediate case, or is it going to be an advanced or severe case? Okay, so you just need to look into the clinical assessment at the very beginning. Okay, then the next thing that we're going to go to is, of course, like I explained in the beginning, we're going to need your impressions, your X-rays, and your intraoral photos. And of course, on top of that, you're going to need your RX form as well. So earlier, like I said, the four things that you're going to need in order to submit a case for OrthoAlign. Alright, then the third thing that we have in the workflow is case submission. So once you have all of this data and information together, okay, you will then submit your case to us. Then the next thing is we will plan the case for you. So we will do the treatment plan. With our OrthoAlign system, we have two ways before proceeding with any of the aligner fabrication. Is we have something called an orthodontic review, and we also have another alternative, which is the direct virtual treatment planning. So orthodontic review is going to be where our orthodontist will analyze and assess the case, all the information you give to us, and our orthodontist will then be able to let you know exactly what is possible with the case. Are you going to possibly need extraction? Do you going to need IPRs done? All this information can be done in the ortho review, which we will get to that later and I will explain further. Okay, then the next thing, of course, after you approve the treatment plan, we will then go into the aligner production. And then after aligner production, that is when you will then issue the aligners out. Okay, so for today, we are only going to be talking up to treatment planning. Okay, so case submission, touching a little bit onto treatment planning. We are not going to go towards aligner production or issuing the aligner. We can do this in another Ask Us Anything for OrthoAlign. But for today, we are going to stop at number 4. Okay, we're going to touch a little bit on number 4. Okay, so the next thing that we can go to is the photos. Okay, so what kind of photos do you need to send to us? Okay, so this is a lot of questions that we do get from our customers, and they ask what photos do you need, and what angles are the photos going to be, especially if you're a first time user of our OrthoAlign system. So some of the criteria that we have is we definitely want to have high definition pictures of the patient. We want to make sure that the photos are clear and not blur. Okay, so the clarity has to be there. Okay, and then on top of that, we also have a guideline in order for you to follow very easily of taking a pictures. So as long as you follow the guidelines that is provided by our OrthoAlign system, you will have no problems in submitting a case to us. Okay, so on the right we can see the pictures here. So we have an example of a clipped lips closed. We have one of a smiling picture, and then we have one of an occlusal cant. Okay, and then we have a right profile, left profile, and then a 45-degree angle profile left and right of the patient. So this is going to help our orthodontist also look at the patient's smile line. It's going to look at the patient's resting lip, for example, and to see if they need to bring in the teeth more or should they bring the teeth out more. So really depends. This is where our orthodontist can take a look of the external of the patient. Okay, and then the next thing that we also need is going to be these intraoral pictures. Okay, so intraoral pictures are very important because they do help our orthodontist to see a better picture. Sometimes we have cases sent by intra-oral scan, and the bite is already been taken by the practitioner. They send it over to us. Our orthodontist, we will actually also double check the pictures with your scans. So we will have a QC check, double check the bite is correct. So if your intraoral scan differs from the picture that you've sent us, we will definitely contact you and ask you a little bit to see whether or not the bite is correct. Because it is very, very critical in aligner therapy that the bite is accurate, or else there may be some issues and there will be some refinements at the end of the patient's treatment. So what we have here on the photos on the right is we have an open bite, we've got a closed bite, we've got a right bite, left bite, upper occlusal and lower occlusal. Okay, and all these, the upper and lower occlusals, right bite, left bite, you can use the oral mirrors that you can use to take the pictures much easily. Okay, so these pictures are definitely very important. Okay, and also our orthodontist can use these pictures to assess possible orthodontic treatment for the patient. Okay, so for example, by submitting all the necessary information like the photos, the x-rays, the RX forms, these are all the bare minimum for our orthodontist to assess and give an orthodontic review. Okay, so these are very important to make sure that you submit. Okay, so it is important as well to note that please do not submit photos like this, because these are not very clear photos of the patient's situation of the dentition. So it's important to avoid pictures that is overexposed, pictures that are dark, and pictures at the frontal that is not using cheek retractor, for example, you know, these are not very ideal pictures. So if I were to jump back, these are the type of photos that you'd want to take. Very clear. You can see all the dentition, the focus is well, the lighting is perfect. So these are how you want to take the photos, and please, we do not accept photos like this. If we don't get photos that are too good, we may need you to retake the photos again of the patient and have that resubmitted to us, because all this information and all this data is critical for our orthodontists in order for them to actually go ahead and do the planning of OrthoAlign for you guys. Okay, so the next thing that we will move to is the x-ray data. Okay, so what is the bare minimum for you to submit for us to do the orthodontic planning? So the bare minimum is going to be the OPG and the lateral ceph. Okay, we have few customers that do send us frontal ceph, but that is an addition. That's extra. It's not 100% compulsory. You don't have to make sure you send a frontal ceph. The OPG and the lateral ceph is more than suffice in order for us to do our orthodontic treatment. Okay, if for example you do not submit the lateral ceph or the OPG to us, you only send us the pictures and you send us impression and you send us the RX form, but you're missing the x-rays. If that does happen, we are not going to be able to plan your OrthoAlign case, because for our orthodontist to actually do the orthodontic planning for you, we are definitely going to need some x-ray or CT data of that patient, so that our orthodontist can know what's going on under the bone. They're going to know if there is any reabsorption of the bone around the tooth. They will know what tooth they can move, or they can see how the roots are actually laid out. So it's very, very important that when you do send a submission, definitely minimum is OPG with the lateral ceph. Okay, so again, it's a must-have for planning of OrthoAlign. Okay, make sure it's clear and not blurry, especially for the OPG. You know, you want to make sure that you avoid any issues and avoid the common errors as well. Okay, so common errors, maybe the patient is not in the center, maybe it's too far forward or too far back, or the patient is looking up or down. You know, you want to make sure that that patient is in the correct position for doing the OPG. And we also want to make sure we don't get too much overexposure or blockings in the OPG as well. Okay, it is also important that when you do take your OPG, if you can export that as a JPEG. If you print out the x-ray, we don't really recommend that you just take a cell phone picture of the x-ray that you've done. It's always better that you can export it as a JPEG and then have that sent over to us. And of course, we would definitely prefer for it to be sent over through the email. Okay, so that is going to be for the x-ray data. So we've gone over the photos of the patients that is going to need in order to submit the case. And then we also talk about this x-ray data as well, and also what photos you should not submit to us as well. So always make sure that all the data that you send to us is clear, it's clear and not blur, and it's in a high quality, high definition of photos. Okay, so the next thing that we're going to do is going to be acquiring the data, for example, taking the impression or using an intraoral scan. Okay, so now, for example, for the intraoral scan, of course, over here we can see this is the Trios intraoral scan. So if you have a Trios intraoral scanner, you can definitely submit cases to us through the Communicate. Okay, but if you don't have a Trios intraoral scanner, you can always send us your STL files or your OBJ files of the format that your scanner outputs. Okay, so 3Shape Communicate, we can definitely accept third-party scanners, and of course we can accept STL files of all kinds. As we know, STL files is the universal file format for any open system to accept scan data. Okay, it is also important when you take your intraoral scan, it's important that you ensure full coverage of all the teeth, of all the dentition that's in the patient's mouth, and if there's any missing data of the scans, they may be rejected. For example, if you do not capture enough of the sulcus area, then you're definitely going to have problems. Of our orthodontists, they will let you know that there is not enough data in order to do the aligners. For example, if you do miss the distal wraps of the last molar as well, that will be a problem, because then our patient will not be able to our orthodontist will not be able to move those teeth. So if you want to be able to do a orthodontic planning with our OrthoAlign system all the way to the last molars, you want to make sure that you get all the way to the distal wraps of the last molars, for example, or the last tooth in the patient. So that's very, very important. So again, here you can see that here we've captured enough of the sulcus area on the upper and on the lower. The dentition is very clear. Okay, it's also very important that you do some sort of scaling before you send the intraoral scans to us. Same as when you take a traditional impression, you want to make sure that you remove any of the buildup of the plaque, or example any calculus on the teeth. You want to make sure you get rid of all of those, so that when you submit to us, we can see the margin of the teeth, of the gingival margin of the teeth very, 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 very clearly. So this is definitely going to be very important. And some of the tips for taking taking the intraoral scans. Okay. Okay, so then the next thing that we want to talk about is impression. Okay, so we talked about intraoral scanning. We can accept that with OrthoAlign system. What about impression? Yep, we can definitely accept impression. Okay, since impression is also most of the widely and most commonly used currently. Okay, so the first thing is you want to make sure you inspect the impression before sending that impression over to us. Okay, because it does create a lot of delays in the flow of your OrthoAlign case. For example, if an impression was sent and then just to hear back from us informing you that the impression is not good enough, then you have to call the patient back and then retake a new impression. This drags the overall turnaround time of the aligners getting to the patient, and if the patient is not patient enough, this can create a lot of upsetness in the patients. So inspect the impressions, okay, for lacks of voids, areas that is not captured properly, no distortion. Make sure it wants to be a clear and distinct impressions, especially on the anatomy or the occlusal of the teeth and the gingival margins of the teeth. Those are very important. Adequately extended, so important that you make sure you capture all the way to as much of the sulcus as you can. I think preferably will be at least probably more than 2-3 millimeters above the gingival margin. You want more than that, maybe 4 or 5 millimeters. The more you have of the sulcus, the better it is. Alright, just you never want less. Okay. Also, you want to make sure that it's free of any debris and extraneous material. So we can also say, maybe for example, you want to make sure that there's no food left behind, or there's no plaque, there's no calculus that's going to affect your traditional impression taking, as all of this can lead to problems further down. And let's say if you were to proceed on an impression that is not great, you are definitely going to have tracking issues, you're going to have fitting issues, and then finally you're going to have a problem with the actual aligner therapy for the patient, which is going to cost the patient much more money. So it is important to take note of all of this as well, because if the impression is not good and is not clear and is not able to pass our QC check for aligner therapy for OrthoAlign, we will definitely reject it, and we will let you know that you need to retake an impression. Okay, so other things as well, make sure you inspect and check there's adequate details, and all of the structures must be recorded. Use a stable material which is sufficiently attached to the tray. You know, don't put too little of impression material that you know, you're unable to catch all the way to the last molars, and also don't put too much material, or else then it's just going to flow all over the place. So you know, practice and try to get the right amount of impression material on that tray. Okay, always inspect the impressions before sending them. Okay, so like I said, any problems will be rejected. Okay, so it is important that you always inspect the impression. If you are not sure, you can always take a photo and then send it over to us, or if you want, you can also pour the stone yourself on your side first, just to double check. If it looks good, then send it over to us. Okay, so very important, inspect the impression, look at the impression, study the impression, and see how you can identify stretchings, how you identify layerings. And normally layerings is the most common when we use the heavy and light body, right? So when we put on the next material to retake the impression to get the higher detail, if we don't insert the impression all the way in properly, then you're going to get layering, and layering is definitely going to be rejected because it's not accurate anymore. The fitting is going to be affected. So it is very, very important again that all of these are taken into consideration before you send us your impression, your impressions of the patient's upper and lower, because the last thing that you want is for us to tell you that we're going to have to reject your impression and that you have to retake that impression again. So good to know is check before you send it. If you're not 100% sure, send us a photo, let us take a look, and maybe we can see how we can help, or how we can double confirm if that impression or the stone that you poured is going to be acceptable for doing your OrthoAlign cases. Okay, so important on that. So here are a bit of some examples of rejected scans, impressions, or stone models. Okay, so we can see here void, so we can see that the cervical margin here is not clear. There's actually a void right here, so the impression material did not capture properly. So this is not going to be accepted. You definitely have to retake the impression for such for the stone if it comes out like this. Okay, over here we can see that there's a little bit of a artifact, or a bubble you could say, maybe on the buccal surface of that premolar. So you can see that it's actually lifted up and it's on right, you know, on the middle of that premolar all the way to the cervical. This is definitely going to create problems, especially for the fitment of the aligners, and of course the tracking of the aligners. It could affect certain movements of the teeth. It could also affect certain forces that are supposed to be applied to the teeth. So we want really nice clear surfaces of the entire tooth structure. Over here at the back, we can see that this is not quite normal. So this is an intraoral scan, but you can see how it's not captured 100%. The last molar is not captured fully 100%, and there is some artifacts over here you can see. Okay, so this inside your intraoral scan, you definitely don't want to have any of these surfaces, as this can cause problems, especially on the gingival part, and also for the fabrication of the aligners. Okay, what we have here as well, okay, is example the capture of that last molar was not fully captured. So if this does happen, our orthodontist will only be able to plan from the first molar and not this this molar over here. Okay, so it's very important that you actually do manage to capture all the way, capture the entire distal wrap, capture the entire distal wrap. Okay, so now what is it? We're just gonna look at this. Hold on one second. We're just gonna look. Sorry, one moment. Having a bit of a technical difficulty. Just hold on one second. Okay, looks like we have a little bit of a technical difficulty. Hold on one moment. Well, apologize for that. It looks like we had some technical difficulty. The screen did not project my slides over there. But you know what? I will just do a quick recap of what I was talking about. Okay, so let's go back a little bit. One moment. So if you were listening to this live stream, okay, so we've started with example the workflow. So we started with clinical assessment. So this is exactly the workflow of what we are going to be doing today. Okay, and we will be catching up all the way to number 4. Okay, so number 4 is going to be where we are going to be at. Okay, so the next thing that we move from there then is the photos. Okay, so the patient photos is like what I explained earlier. Okay, it's going to be make sure that it's all in high definition, it's clear, it's not blur. We follow the guidelines. Okay, so these are all the photos that we are going to need. These are very important. So the more photos you have, the better it's going to be for us as well in terms of planning the orthodontic case. Okay, then the next thing that we have as well, alright, is the intraoral pictures. So just like I explained earlier, okay, we are definitely going to need a picture of an open bite, a closed bite, a right bite, left bite, upper occlusal and lower occlusal. So these are going to need to be taken as well with your dental mirror in order to capture these. So we always want to make sure that you use a high quality camera and ensure you get a high quality picture as well of the patient. Okay, you also want to use these pictures. It helps our orthodontist to see better, helps to double confirm the bite as I explained earlier, and with these photos our orthodontist can also assess the possible orthodontic treatment for your patient as well. Okay, so these are the type of photos that I was also showed earlier that is not going to be accepted. So you can see that this photo is way overexposed, this photo is a bit dark, and then this photo here you can barely see the frontal of the teeth. You definitely want to use a cheek retractor for that. Okay, so these are photos that we're definitely not going to be accepted for our OrthoAlign submission. Okay, and then as I also went on over earlier, the x-ray data, okay, you're definitely going to need some of this OPG and lateral ceph. Okay, so OPG and lateral ceph is going to be the most the minimum the minimum requirement for the submission for OrthoAlign. Okay, you must have an x-ray definitely for this x-ray data, and you want to make sure that it's clear, it's not blurry, and you want to send set the JPEG, send it to us as a JPEG, and not taking it with your phone, with using your phone camera. Okay, so also avoid the common errors for when you take your OPG or your lateral cephs. Okay, and then as we move forward, again we got our intraoral scans. Okay, so intraoral scanners, we can accept Treeshape Trios intraoral scanners, so you can send us your cases by Treeshape Communicate. We can send us by using your third-party scanners, and then you can also send us using STL files, which is very common in open system intraoral scanners. Okay, and it is also important to ensure full coverage of all the teeth. If there's any missing data, scans may be rejected. So you want to make sure not only you capture as much of the dentition of the teeth, you also want to make sure that you capture the sulcus area as well. So these are all the important things. Okay, so now as we are about to catch back to where I left off, inspect the impression. That's going to be very important. So lack of voids, no distortion, clear and distinct impressions, adequately extended. So you want as much of the sulcus area all the way back to the distal wraps, okay, of the teeth. You want to make sure that it's free of debris and extraneous material. Adequate details and all structure must be recorded using a stable material which is sufficiently attached to the tray. And always want to inspect impression before sending us. So just like how we explained earlier, if you do send an impression to us, maybe it was not checked properly, there were some layerings on the impression, maybe there are some stretching on the impression, these impressions will be rejected. Or if there is not enough scan data, or this impression did not capture enough of the patient's oral data, then there is definitely going to be rejected. Okay, so it's always important that you do, maybe if you want to double check, you can always take a picture, send it over to us. We will try to see if we can validate or accept the impression or the scans from you. So then if not, you can go ahead and retake a new impression. Okay, because it is also important that you do check your impressions before you send it to us, because if we do have to reject your impression, you are definitely going to have to retake and you're going to have to call your patient back again. So rule number one, always do check your impression, inspect your impressions before submitting it to us for OrthoAlign treatment. Okay, so now that we are catching back again as well, these are the rejected scans. Okay, so it is important, for example, that you want to make sure that there's no voids. So you want to make sure that you don't accidentally not capture certain areas, especially on the gingival margin area. That is quite critical in order to get to see for our orthodontist to segment the teeth. Okay, things like this you want to avoid. These you want to avoid. And for example, here it was not captured fully all the way to the last molar. So this is quite a bit of a problem. So you want to make sure that you try to capture all the way to the distal wraps, because if you don't capture all the way to the last molar, then we will not be able to move it. Our orthodontist will not be able to move it. They will only be able to move this molar over here and onwards. So if you miss the data like this, it's going to be a problem. So always try your best to capture all the way to the last molar. So this is just some of the ideas of or some of the situations where the impressions are not great. Okay, so it's important to ensure you avoid any of these issues. Okay, so over here we can see that the last molar definitely has stretching there. Okay, so you have to get familiar with reading and understanding your impression. So things like this stretching, definitely this last molar, we're not going to be able to move it. We can see that over here the patient bit too far into the tray at the front, which is why we got all of this missing data over here. So this definitely will not be accepted. Over here we can see that the last molars are not properly captured, so that's going to be a problem. And we can see that the patient actually bit here and then down into here. Okay, so this is also not a very good impression. And then another one here is you can see that the patient bit once and then came out and then came in and bit the impression back down again, causing this double dentation to appear. So these are definitely going to be rejected by our orthodontist when you want to do an OrthoAlign with us. So it is very critical that you do send us an impression that is clear, there's no stretching, there's no inaccurate biting into the tray. You do not have any of this missing data of the last molars, and then as well as the patient does one nice straight bite into the impression tray. Okay, so these are very, very critical. Okay, so then the next thing that we have is our RX form. Okay, so this is one of the next things that you're going to need in order to submit your OrthoAlign case to us. Okay, you can use this RX form that we have here, and the great thing about it is you can fully enter all the information digitally. So from your computer you can just click in and you can type in all the information, the name, the age, the gender, what is the chief complaint, what is your expected treatment. It's a very, very comprehensive form, so spend your time on this so that our orthodontist will be able to plan according to what you are expecting. Okay, so it's a very friendly, user friendly, and we get to save a lot of paper on that, so no wastage of paper. And if you do need, you can always visit our website at orthoalign.asia/resources, and this is where you can actually download all of that information. So you can download all of our information on the photos that you need to take. You can download the information of the RX forms. Everything is downloadable there for you to be able to use as a guideline for you to submit your RX form. Okay, so very easy to use RX form. Okay, so again, where do you submit your cases? So you got all of this together. You have the RX forms, you have the patient's photos, you have the x-ray data, you have the impression as well, or the intra-oral scan. Where are you going to send all these cases to? you are going to submit all of these cases to support@orthotech.asia. This is where you can submit all your cases in order to do your OrthoAlign with us, or you can also ask any questions or inquiries. This is where you can actually submit here. You can send all of those questions as well to support@orthotech.asia. Okay, or if you want, you can also use communicate. So 3Shape communicate. And we also use this communication and approvals of case are done with our email. Okay, so this helps to keep a good track of communication about the case when it's been approved, and we can easily track the communication back and forth with our orthodontist and you as the practitioner that's going to be issuing the OrthoAlign clear aligner solution. Okay, so this is where you can submit your cases to. Okay, so post-submission. So after you've submitted the case, what are you going to get back? Okay, so it's good to note that after you submitted your case, what can you expect? Okay, so you can expect an ortho review. Okay, so this is one of the two options. Okay, so what is an ortho review? An ortho review is a written review on your case before actually doing the full virtual treatment plan. Okay, and this ortho review will actually be assessed by our orthodontist, and our orthodontist will assess your case and take a look at it, and will be able to let you know roughly how many aligners it's going to take to do your case, and as well as it will also let you know what is the possible orthodontic treatment for your patient as well. Okay, so it also allows the doctor to anticipate the virtual planning outcome. It also gives the possibility of treatment, estimation of aligners needed, and treatment possibility according to desired treatment request. Okay, and of course, if maybe any extractions are going to be needed. So for example, when a doctor sends us a case, we can do an ortho review without the impressions or the stone models. With your x-ray, patient photos, and the RX form, this is what we can use to do our orthodontic review. So definitely it's going to be quite important for you to let us know if you want to do an ortho review first, or you want to straight go for the virtual treatment planning. Okay, so normally some cases where, for example, if any of our doctors need to retake an impression, we will normally say that we will do an orthodontic review first, in the middle, in between the time of the doctor having to retake that impression. So then the next time the patient comes, then the doctor also does have something to explain to the patient. Look, this is the orthodontic review we have for you. This is what our orthodontist has to say, and then retake that impression, double check it that's good, and then we can do the virtual treatment plan after that. Okay, so orthodontic review is good. Okay, so review without impressions or intra-oral scans. Okay, so this is an example of an orthodontic review. So if you submit your case to us and you want an orthodontic review, you can get this kind of information. So what our orthodontics can explain here a little bit is say what the case presents. Example, a class 1 malocclusion case. Okay, and then it will actually let you know what is some of the treatments that you can do. So for example, only correcting the crowding or crowding correction is expected with minimal correction of protrusion. Okay, we can see that there's definitely going to be a minor arch development, definitely going to need IPR in both arches. Okay, and then you can see, for example, as we go more, we can see that in the lower arch alignment will be done using space created by arch development and the IPR. However, if the doctor does want to go for a complete correction or protruded anterior teeth is expected, then they're definitely going to consider extraction of the bicuspid. So with an orthodontic review, you already also know what you can expect for the patient, for the treatment of the patient with our OrthoAlign system. So you can let the patient know, look, we have this and we have this. What is the option, or which treatment would you like to go for? Then on top of that, our orthodontist will then categorize your case as, for example, an OrthoAlign Max category. And what they mean by OrthoAlign Max is basically indicating that it's going to be more than 30 stages to actually complete. So it's going to be more than 30 stages to complete your OrthoAlign for this treatment. And then, for example, we'll ask the doctor, let us know how shall we proceed. If they're happy and they let us know which one they want to go for, then we will proceed and do the virtual treatment plan. Okay, so that is one of the reviews, orthodontic reviews. Then the other one that we have as well over here is another orthodontic review, and this one we can see it is called an OrthoAlign 20 single arch category. Okay, so what it actually means right there is that this orthodontic case is not going to be more than 20 stages of aligners on that single arch. So by giving us all that necessary information, even without the models or impression, our orthodontist can already estimate roughly how many stages of aligners it's going to be. Okay, so more of the information will then be put in here. What can they possibly do? What do they need to do? Do they need to do IPRs? Do they need to do extractions? All of this will be put there, and then we can see that the posterior occlusion will be kept unaltered. So going to be important for you to know, and by just knowing roughly the estimate of your OrthoAlign treatment for the patient, then the patient is also more aware of how long treatment is going to be and how much is the possible cost of the OrthoAlign treatment for the patient. Okay, so after we go next, now we can talk about treatment plan. So the virtual treatment plan. Okay, so in the virtual treatment plan, this is the final one that you're going to show, that has the videos and everything. It is going to definitely tell you the exact numbers of aligners which can be determined. Okay, as our orthodontist is going to plan your orthodontic case, you will know exactly how many stages of aligners. Okay, this will then also allow doctors and patients to view the actual treatment, okay, and the movement of the teeth. Alright, so this is definitely going to be a bit more of a visual aspect for the patient, so that the patient can sort of see and expect what the outcome is going to be. Okay, you can do adjustments to the virtual plan. Okay, so our virtual plan and our treatment plans will always come in versions. So version 1, version 2, and etc. and etc. So every time you make any adjustments, we will just change it to the next version. So then we will know what version you are going to be approving the treatment plan on. Okay, so that is going to be quite important as well. For example, when you receive your virtual treatment plan, if you want to make any adjustments, you can just let us know. Maybe you want to intrude the teeth more, or you want to rotate the teeth more. We can definitely make any of those adjustments in the virtual planning, and then give you the new and latest version. Okay, so now we also can talk about IPR and attachments. Okay, so with IPR and attachments, the virtual treatment plan will be able to let you know exactly where you need to do IPR and where you need to place these attachments. So everything will be decided for you. Okay, and then must have all pre-submission requirements. Okay, so when we talk about the virtual treatment plan and how you can get the virtual treatment plan, is that you have to make sure that you have all the pre-submission requirements. When we talk about the pre-submission requirements, we are talking about this one over here. Let me just show you right here. So pre-submission requirements. So you're going to need all of this information in order to go for the orthodontic virtual treatment plan. If you only want to do an orthodontic review to begin with, then you can do patient's photos, the x-ray data, and the RX form up to 1, 2, and 3. Okay, so that's how you're going to need to know exactly how you can submit the case. Okay, so what we can go next. Okay, let's go. So this is for one of the guides that you would receive. Okay, so in our OrthoAlign system, we will have an IPR guide. Okay, so the IPR guide will tell you exactly where you need to do the stripping of the teeth and by how much. So over here we can see you need to strip between the 3 and the 4. So the lower 4, 3 and 4, 4, you're going to strip about a total of 0.4 millimeters. And then over here we got 0.5 and 0.5 millimeters. Okay, it is going to tell you where you're going to do it. So we can see that this is version 1. So this was the first treatment plan created. and this is on the first aligner, okay, and it's telling us that you need to do your IPR before the first stage of aligners. Okay, when we look at the second one over here, you can see that you need to do the IPR before stage 11. So what we can see is that once the patient is finished with stage 10 of aligners, they are going to do the stripping of here indicated and then move to the next stages of aligners. So everything has been indicated very clearly. The doctor will be able to know very clearly when and where he's going to need to do the interproximal reduction. So these are some of the things that you get in the virtual treatment plan. The next thing that you will also receive is these attachment guides, okay, and the layout is similar to your IPR. So we got subphase. Subphase is basically telling you what stage of aligner, okay, and we can see here, okay, that in the upper, wherever it's indicated in green color, this is where you're going to need to place the attachments. Okay, so all attachments need to be placed here. Okay, we also tells you what kind of attachment. So we got a vertical bar on the 2-2, and all of the remaining are going to be horizontal bars. Okay, so depending on what type of attachments our orthodontist uses is going to be the reason of, or depending as well on the direction of what our orthodontist is trying to move the teeth, whether it's a rotation or it's an intrusion or extrusion of the tooth. Okay, so on the second one that you see over here, we can see that later, before stage 11, okay, the doctor is going to have to place 4 more attachments accordingly here. Okay, so once the patient is at the end of stage 10 of the aligners, he will then have to go ahead and put, for example, the aligners on the put the attachments on the patient's upper teeth over here, and we can see exactly what is actually being indicated, and again the type of bars that's being used. Okay, so in your virtual treatment plan, you have the IPR guide, you have your attachment guides. We also do provide a PowerPoint presentation as well. So the PowerPoint presentation is actually going to show you exactly the original position and then the final position, and we also do show the tracking. So exactly the teeth are moving one by one, all the teeth that are moving. We also have all of that information as well in the other documents. Okay, so this is some of the information that you get when you submit an OrthoAlign case. Okay, and then of course the next thing as well is a video. So with our OrthoAlign system, you will get a treatment plan video, and this treatment plan video is going to show you the movement of the teeth. Okay, so you and the patient will be able to see the actual movement. It can be visualized. We will show you in the different angles, and you will see the movement of each stage. So as we transition over here, you can see, yeah, so over here you can see in the video, you can actually see the teeth are actually moving. So this is what you will receive as a treatment video. Okay, and then on the top left hand corner of the videos, you can actually see, for example, the numbers. So the numbers that you see there is actually the numbers of stages. So as every stage goes up, you will see that the numbers do go up as well. Okay, so you can see all the stages slowly climbing higher and higher and higher. Okay, and then at the end of the video, what you see on the PDF sort of is actually a design comment. So this is actually our orthodontist will also indicate exactly what the doctor needs to expect for this treatment plan. Okay, so again we can see, so the one over here in the middle on the bottom, okay, we can see that it's quite substantial movement. There is quite a lot of stages as well for this. So you'll be able to see all the teeth slowly moving. And what you see in the blue there as well, the blue is actually the attachments that are going to be placed on the patient's teeth. Okay, so you notice that a lot of the attachments, they're not exactly the same. There are different attachments, different shapes, different sizes. Some attachments you can see that they are actually placed on the palatal side or the lingual side of the teeth, and all of these attachments help to provide better retention of a better grip as well of the teeth, as the plastic tries to slowly move and manipulate the teeth and try to put the forces and try to pull the teeth to certain areas. So this is all the virtual treatment that you can receive. So if you would like to also view any of these samples, if you would like to see more information, if you would like to be able to see some of the samples of this if you would like to see more of this information of the treatment plan, you can always visit our website at orthotech.asia, OrthoAlign.asia, and on that website you will be able to go and take a look at the samples that we have on there. You can take a look at the cases that we have on there. You can see the samples that we have on there, that you can understand what you're going to receive in terms of a treatment plan. Okay, so in terms of the treatment plan, this is what you really get. The only things that I have not shown you today is going to be the PowerPoint presentation that I have not put up on here, and then of course a little PDF that you also get. So you get quite a comprehensive treatment plan with our OrthoAlign system. So you are very, very well understood of exactly what is going to happen for your case. Okay. Okay, so now as we go back to our presentation, making sure that you guys can see this. Okay, so that is the treatment plan that you've seen. Okay, in our treatment plan, at the beginning it will tell you OrthoAlign 30 or OrthoAlign 20 or OrthoAlign Max or OrthoAlign Dual Max, right? All this information is just letting you know that is going to be no more than that amount of stage. However, when it has that word max at the end, then it's just going to tell you that it's going to be more than 30 stages of aligners. Okay, so now what we can do is thank you very much. I apologize for the beginning of the presentation that we had some technical difficulties, but luckily we did manage to rectify that. However, now is the time. If you guys have any questions that you would like to ask, please feel free to drop us any questions, and I will now take a look to see if there are any questions available during this live session. So just give me a moment while I take a look. Okay, so I got a few questions over here. Okay, so how long does it take to receive the plan? So for example, if we were to talk about the orthodontic review, where our orthodontist just assesses your case, we can easily do your orthodontic review in 1 to 2 days. For your virtual treatment plan, we will have that for you in 3 days. So 3 working days, we will have the orthodontic virtual treatment plan back into your hands, so you can very quickly get back and engage with your patient. So 3 working days for the orthodontic for the final virtual treatment plan, and about 1 to 2 days for the orthodontic review for your case. Okay, so what else do we have here? If I forget to submit photos or x-rays, can I still get an ortho review? No, unfortunately not. If you forget to submit photos and x-rays, and our orthodontist can only look at a stone model, for example, If he only has a stone model and an RX form to work on, he will not be able to give you a single accurate assessment of the orthodontic possibilities for that patient, because our orthodontist does not know what's going on underneath, and there is no patient photos to really see exactly what can be possibly done. So again, for an ortho review, the minimum you need is the photos of the patient, x-rays, and the RX form. You can do an ortho review without the stone models or without the intraoral scans. Okay, so please take note of that, as if you do forget to send photos and x-rays, we will not proceed on your case until you do submit and you do provide us with the complete submission. Okay, so what else do we have here? So a good question here, for example, is can I request for my patient's treatment plan to be with or without attachments? So our OrthoAlign system is also very, very flexible. We're not very rigid. So for example, some doctors, they don't want to put attachments for certain reasons. Our orthodontist can plan without attachments. However, if you do cases without attachments, you are probably going to expect to need to have to do more refinements of the orthodontic treatments at the end. Okay, so it is very important that that you do note that. But for example, if we do without attachments, if we're going to do without attachments, we can definitely do that. If, for example, you want to place all the attachments at the very beginning, we also can do that. If you want us to do attachments staggered across the treatment plan, yes, we can also do that. And it's the same for anything else. If the IPR you want to do all at the beginning, we can. If you want to stage it, we can. So we are very flexible, and we are very open to also listen to what you are possibly going to want to do for your treatment plan. Okay, so another question that we actually got here as well is, what is the difference between a free assessment and final treatment plan? A free assessment is basically the ortho review that I showed you, for example, earlier. Okay, so so free assessment is, let's see, this is your free assessment or your ortho review. Okay, and then this is going to be your final virtual treatment plan. So the final virtual treatment plan is where our orthodontist will actually work on your case. They will actually segment your teeth individually, and we will plan your case. An ortho review is merely our orthodontist just looking at your case, looking at the data that they've received, and being able to give an estimation on the aligners. Whereas with the final review or the final virtual treatment plan, that's where you can get the exact number of aligners. Okay, and it is important to take note that the ortho review is free, as well as the virtual treatment plan as well. So we don't charge for virtual treatment plan. So when you submit, you only pay once we issue the aligners to you. So continuing, can you incorporate adjuncts and TADs? So yes, we can definitely incorporate adjuncts such as TADs. We can even incorporate myotherapy in our OrthoAlign system. So like myo munchies, for example, you can use in our OrthoAlign system for the younger patients where they are still developing and growing in their growth of the arch. You can use the myo brace, we can use TADs. So our orthodontists can definitely plan our OrthoAlign cases using TADs. So for example, if you're doing quite a severe case with by4 extractions, and you really need to pull those teeth mesially or distally, for example, and it's quite a substantial amount, yes, you are definitely going to be recommended to use TADs. We also can incorporate adjuncts like buttons and elastics as well in our system. So we do have a very full and comprehensive OrthoAlign system for the doctors, whether you are just starting up with your OrthoAlign, or for those advanced users who have used aligner systems for a long period of time, or they are very advanced orthodontists. Our system can cater to all of those doctors. can treatment be done without extraction? Yeah, of course, treatments can be done without extraction, but with limitations. So if, let's say, the patient needs to bring in the teeth, as maybe their teeth are very overjet, for example, if they need to bring in the teeth, you definitely have to do an extraction. But not all cases you need to do an extraction if it's a minor crowding, for example. But if, let's say, the patient does need to do an extraction and you decide not to do an extraction for the patient, then you're going to be very, very limited in what the possible treatment plan you can do for the patient. Okay, so I think we got one more last question over here. How effective compared to traditional bracket? So what we can say is aligner therapy is just as effective as traditional brackets. However, it does come with a lot of responsibility of the patient, a very high patient compliance as well. If the patient does not wear their aligners for 22 to 23 hours a day, then of course aligner therapy is not going to be effective. It's not that the aligner is not effective, it's because of the external factors that the aligners are not worn for a long enough time. Of course, aligners, there is still patient selected cases that you can do and you can't do. Some cases can be very hard, especially if you're going to incorporate TADs, extractions, correcting severe crossbite, for example. These are going to be very difficult with aligners. However, it's not to say that you can't do it with aligners, it's just that it's going to be a little bit more difficult using the aligner system. So it is important as well that when you submit your case to us, you just let us know. Let us assess your case to see what's the possibility with your case. You let us know what you don't want to do, what you want to do, and we will make sure that we do plan accordingly. Okay, so as we continue, let's take a look and see if we got any more questions. So we do have a question over here. Okay, so a question was asked, who was our orthodontist? So our orthodontist is actually our OrthoAlign treatment plans are all being planned by our orthodontist in Italy. We do work very closely with our orthodontist in Italy, which, as you know, we also are quite well having a good relation with our Italian counterparts. So our orthodontist in Italy actually does all the planning. So don't be surprised that we can only give you orthodontic answers after 3 p.m. of the day, as Italy is 7 to 8 hours behind. However, be rest assured that we use fully qualified orthodontists to do the planning. From the answers and the orthodontic review that you receive, you will definitely be very confident in using our system, as you will know that some of the lingos that they use, the words that they use, and their experience that they use, you can be very well confident that our orthodontists in Italy are definitely doing a very, very good job. We do have a lot of cases that has already been successfully done and completed, that we are already going to be looking to post a lot of cases on our OrthoAlign website. Okay, so in terms of who's planning our cases, our orthodontists in Italy are all planning our cases. Okay, so let's just take a look to see if we have any further questions. Any more questions? I guess we will just give another 1 or 2 minutes, and then if there is no more further questions, we are going to end this live session. So while I wait another 1 or 2 minutes, we will just hold on here a little bit. If you do have any further questions, please do just let us know. Okay? Alright everybody, thank you very much for watching our live session of Ask Us Anything. Okay, so what we're going to do now is we are going to sign off, and we're going to say thank you very much for everyone that has watched and has tagged along on this live session. Again, if you have any further questions, please feel free to contact us at OrthoTech, or you can visit our website OrthoAlign.asia. Feel free to drop us an email. Feel free to give us a call, and we'll be more than happy to help you start your journey with OrthoAlign, the new affordable system for you and your patients. Okay, thank you very much and have a nice evening. Goodbye.